When we identify a patient with an EGFR mutant form of lung cancer, we know that there's a mutation in their tumor. That helps us figure out the first line of treatment, the initial therapy for patients. Now, some of the initial work identifying drugs for patients with EGFR mutant lung cancer focused on patients who had had multiple prior therapies. But over the last 5 years, we've had the luxury of big randomized clinical trials where we take hundreds of patients and randomize half of them to treatment with chemotherapy and half of them to treatment with EGFR tyrosine kinase inhibitors, drugs like erlotinib, gefitinib, and afatinib. When we look at those trial results, we see really remarkable improvements in the chance of tumor shrinking, so that it's much more likely that with these oral treatments for lung cancer like erlotinib, gefitinib, and afatinib, that the tumors will shrink, much more likely than with chemotherapy. Importantly, it's also shown that from these trials that we see much longer time until the cancer grows. So taking a pill leads to longer disease control than we see with the IV chemotherapies.